Root canal treatment, also known as endodontic therapy, is a dental procedure that is performed to treat and save a tooth that is severely decayed or infected. The procedure involves removing the infected pulp from inside the tooth, cleaning and disinfecting the root canals, and then sealing the tooth to prevent further infection. While the thought of getting a root canal may seem daunting, it is actually a common and relatively painless procedure that can help alleviate pain and save your tooth. In this video, we will discuss the procedure for getting a root canal in detail. 1. Signs that you may need a root canal. Before getting a root canal, it is important to recognize the signs that indicate you may need the procedure. Some common signs that you may need a root canal include severe toothache, prolonged sensitivity to hot or cold temperatures, swelling or tenderness in the gums, a pimple on the gum, and darkening or discoloration of the tooth. If you are experiencing any of these symptoms, it is important to see your dentist as soon as possible for an evaluation. 2. Preparing for the procedure. Before getting a root canal, your dentist will first conduct a thorough examination of your tooth to determine if a root canal is necessary. This may involve taking x-rays to assess the extent of the infection and plan the treatment. Once it is determined that a root canal is needed, your dentist will explain the procedure to you and discuss any questions or concerns you may have. 3. The procedure. The root canal procedure is typically performed in 1 or 2 visits to the dentist's office, depending on the severity of the infection. During the procedure, your dentist will first numb the area around the tooth with a local anesthetic to ensure you are comfortable. They will then make a small opening in the tooth to access the infected pulp inside the root canals. Next, the infected pulp is removed, and the root canals are cleaned and shaped using special instruments to remove any bacteria or debris. The root canals are then filled with a biocompatible material called gutta-percha and sealed to prevent further infection. In some cases, a temporary filling may be placed on the tooth until a permanent restoration, such as a crown, can be placed. 4. After the procedure. After the root canal procedure is complete, you may experience some discomfort or sensitivity in the treated tooth for a few days. Your dentist may recommend over-the-counter pain medication to help manage any pain or discomfort. It is important to follow any post-operative instructions provided by your dentist, such as avoiding chewing on the treated tooth until a permanent restoration is placed. 5. Follow-up care. After a root canal, it is important to attend any scheduled follow-up appointments with your dentist to ensure the treated tooth is healing properly. Your dentist may recommend x-rays to monitor the healing process and ensure that the infection has been successfully treated. It is also important to practice good oral hygiene habits, such as brushing and flossing regularly, to prevent future infections and maintain the health of your teeth and gums. In conclusion, getting a root canal may seem intimidating, but it is a common and effective procedure for saving a severely decayed or infected tooth. By recognizing the signs that indicate you may need a root canal, preparing for the procedure, understanding the steps involved, and following post-operative care instructions, you can alleviate pain and save your tooth. If you think you may need a root canal, schedule an appointment with your dentist to discuss your options and determine the best course of treatment for your dental health.